Hi everyone, I'm Dr. Sheyi, and it's nice to be here once again. I'm a fertility and conception expert. Today we are going to be talking about an important topic in reproduction, and that is hormonal imbalance. Hormones are generally chemicals that helps the body to function optimally, and there are different hormones for different systems, and there are some hormones that are for general system. So we are going to be looking at hormones that function in the reproductive system of the body. Now we have different hormones that functions in this reproductive system of the body. When they are in disarray, that is when you can say a woman or a man. Hormonal imbalance can affect both man and women. So if these hormones are imbalanced, that is when you say, okay, this woman is having problems with her hormone. And there are different hormones in the body that function particularly on the reproductive system. The hormones include follicle stimulating hormone, which is important in mobilizing and helping to grow follicles, which are eggs. We have the luteinizing hormone, which is important in ovulation. The estrogen and progesterone, they are very important in maintaining the uterus, so help you to prepare it for implantation and also maintain the pregnancy. There is testosterone there, which is majorly a male hormone, though it's seen in small quantity in the woman too. Also, we have thyroid hormones. Thyroid hormones are very, very important hormones, and they are important in the general function of the body, not only the reproductive system. So if they are in desire, they can affect the other parts of the body functions. So what are the causes of hormonal imbalance? We have different causes. The causes include polycystic ovarian syndrome, which we have had, at least I'm sure we have heard about it for a while, and it's when you have increased testosterone in the woman, which is not supposed to be, and such to start affecting the normal reproductive functions of the woman. Hyperprolactin. Prolactin is one of the hormones that I didn't mention before. Prolactin is important in milk production. So if this prolactin is higher than normal, it can affect the ovulation, it can affect the menses of the woman. So the woman will not say her menses, it can affect the cycle. Also, we have thyroid problems. If there are thyroid problems, either it's high or low, hyperthyroidism, hypothyroidism, this can affect the normal reproductive function of the woman. It can also affect the normal reproductive function of the man. Even hyperprolactinemia, all those ones that if the testosterone is low, can affect a lot of things in the man. So it's not only hormonal imbalance is not only affecting the woman, it affects the man too. There are other ones that are not generally hormones, but they are once they are there, it can affect the hormone function. These include obesity. Obesity, once a woman is getting fat or a man is getting fat, can affect the hormones of the system of the body. Also, cigarette smoking. Cigarette smoking has been found to affect hormones. Alcohol, hard drugs affect hormones. Cocaine, marijuana, all these drugs, they have one way or the other affect the hormones. So these are some of the causes. There are other causes, but these are some of the causes that can affect the hormonal functions of the body. So how do you know that you have hormone imbalance? If you have menstrual irregularity, a normal menstrual cycle is between 21 to 35 days. Now, if your cycle is more than 35 days, the likelihood that you have hormonal imbalance is high. So if you are seeing your menses 3-4 times a year, it is not normal. So that means that you may likely have hormonal imbalance. If you are having problem with difficulty with getting pregnant, the other things that can make it difficult to get pregnant, but hormonal imbalance is one of the major causes of hormonal of infertility. Also, if you are having either you are hairy as a woman, or you are getting balded as a woman, having beards, hairy chest, it can be that you have hormonal imbalance. Dry skin, reduced libido in a man, these can be due to hormonal imbalance. So these are the few ways by which you can know that you have hormonal imbalance. And how do you treat hormonal imbalance? Hormonal imbalance treatment is majorly dependent on the cause of the hormonal imbalance, and you treat the hormones that that are having issues. However, there are general treatments or there are general management for hormonal imbalance, and this majorly is due to life. I mean, it's majorly lifestyle modifications, lifestyle changes. If you are obese, you need to lose weight, exercise regularly, change your diet. This will help you to lose weight or make your weight to be optimal. And once you lose weight, in 60% of cases, if you lose about 6 to 10% of your weight, you find that a lot of these things are reversed. You start seeing your menses regularly, you start ovulating, and you get pregnant. If you are smoking, you need to stop smoking. If you are taking alcohol, you need to stop alcohol. And these are important things. Once you stop most of these things, you tend to get better and you tend to resolve most of these problems. So, however, for other treatment, depending on the course, will depend on how you will treat it. And we will be talking about a few of these problems in other videos. So, by and large, these are the major causes of hormonal imbalance, and lifestyle modification is a major way to go about treating this problem. So, I'm Dr. Sheyi once again, your fertility and conception expert. You can check our pages on Instagram and Facebook on Ask Dr. Sheyi or Ask_Dr. Sheyi, and you will see a lot of other topics that we've discussed. You can also, if you want to have a personal consultation with me, you can WhatsApp me on 08066275937. Mind you, consultation is not free. So if you are coming for consultation, online consultation, be prepared to pay. We have also a WhatsApp group for pregnant women per trimester. Trimester is 3 monthly, depending on the age of your pregnancy. So you can also join. A lot of women are on the page on the group, and they are enjoying being on the group. They are learning a lot. They are having free time to consult with specialists too. So, and we will be expecting you to come and join if you are pregnant. So till the next video, take care and remain blessed.